Welcome, everybody, to today's PermanenteDocs Chat. I'm your host, as always, Alex McDonald. I practice family and sports medicine as part of the Southern California Permanente Medical Group here in Fontana, California. And today we have an amazing guest, Dr. Wadie Marcos. And so, Dr. Marcos, thank you so much for joining us today.
Thank you so much, Dr. McDonald, for having me, and thank you for hosting these sessions. I find them very stimulating. I just listened recently to one on the cancer care, the national cancer care that we're doing, which was very informative and pretty impressive.
Oh, wonderful. Thank you so much. I'm glad people are listening. Sometimes I feel like I'm just like talking out into the ether. So I'm glad people are finding this useful. So thank you for joining us, and thanks for everyone out there listening as well. And great plug to listen to some of our more recent episodes. So take a look at our YouTube page. Make sure you like, subscribe, and follow along. Today, we are talking about the patient care experience, specifically here at Kaiser Permanente, but kind of more in general, the patient care experience. And so we're going to jump right in here, and hopefully this is another great conversation that people find useful. So again, Dr. Marcos, we'll start with my normal question. Tell us who you are and what you do.
All right. I try to be like you, Dr. McDonald. So I'm a family physician as well. I joined SCPMG straight from residency in 2006. I actually trained near you at Arrowhead Regional Medical Center, if you're familiar with it.
I
And
am.
I actually did my addiction medicine rotation at in the Fontana KP facility. And so I've been since 2006. Since then, I became in charge of a building and then two buildings, and then I came to regional access and now with regional care experience.
Wonderful. And again, let's sort of identify terms here. So we hear the term care experience. What does patient care experience mean, I guess, to you, and what does it mean kind of globally across healthcare in general?
Yeah, it's a fuzzy term, to be honest, and it means a lot of different things to a lot of different people. I'll just share maybe what it means to me and kind of how it applies to my role. But
Please.
I think it's actually way broader and way bigger than that. And so for me specifically, it's the how do we make a patient feel? That's one component. And the other is how do we get the patient, make it easy for the patient to come in and see us?
Hmm.
So if I had to give it two terms, it would be service and access. And that's kind of what my role is. If you want me to zoom in a little bit on that, or why that's an important thing, or why should we care?
Yes, please.
I think one is, I'll just start with access. Access is so important because that is the reason the patient signs up with health insurance, is so that they can get care, so that they can come and see Dr. McDonald, so that they can come and see any of us as physicians, whether primary care or specialty. And so we have to get that right, or else the patient, if they pay for something and they don't get the service that they are expecting, the access, they're going to go to a different entity or a different insurance company. So that's a very important piece of it. The other thing that's part of this is service, which is how do we make the person feel? That is also very important because that's what can drive loyalty. It
Hmm.
also drives patients to connect with us. One of the things that I enjoyed when I had a panel is having my panel and going on a journey with the patient. And the words I say to them are sometimes way more powerful. They want to hear from me, sometimes even more than a specialist, because of that connection that we have with them. And so it drives loyalty. It drives them to want to be with us, and it's really important for any office, any company to stay in business. Is you want that person to be loyal to you and to tell others about you to come to you. So that's why I think it's very important to me, and it's very critical work to do. Some of it is, math, and some of it is soft skills that we have.
Absolutely. Let's talk a little bit. I want to kind of put those soft skills aside for a second. I definitely want to come back to that issue because again, as a primary care physician, that's something that's really important to me. And I think sometimes we don't necessarily realize the importance and the role that each of us individually as physicians can have with patients, both within the exam room, but also kind of globally. But we'll come back to that a little bit in a second. Can we talk more about the you kind of alluded to this here. Healthcare is a business, right? And patients have lots of options, particularly in a busy market like Southern California. But in a lot of places, patients have choice when who they see for their healthcare in terms of physicians or medical groups or even insurance plans. And can you talk a little bit about sort of the evolving landscape within which we all have to operate as Kaiser Permanente, but also as physicians and healthcare providers, and how patients' perceptions and the experience they have can impact those choices and the business of medicine?
I'll just start with the expectations because that's not that's the non-soft stuff. I've been through multiple focus groups to ask patients, what do you want from an access perspective? So to your point, to the business, we have to deliver if you want to be viable. Even if we're a solo practice, it's a business and it's a clinical practice.
Mm-hmm.
The expectations that the patients have said 10 years ago compared to a few years ago, because I sat in on both, listened with my own ears to so I didn't just see the qualitative data and the quantitative, but I actually heard it myself. The only thing that's different is they wanted access back then and now. It's just they want it sooner now. So that is a very different thing. Everything is right here, right now. We're so used to going on the phone, clicking something, and then if it doesn't give us the result right away, we think the world is falling apart. So
Right.
that piece is very different. The second thing that is different is the access to information. I'm sure you get this as well, but many times the patient, they go in and part of this, they actually get a lot of anxiety because if you type in any symptom, cancer comes up. And so it's
Absolutely.
not uncommon that many patients, they come in and I could tell they kind of like, especially if I'm not bonded with them, they start to ask certain questions and I'm like, you don't trust me. Did you happen to consult with Dr. Google before coming to see me? And so once we get that out in the open, and then I ask them, what are you afraid of? And then I usually say, is it cancer? They say yes. And then we talk through it and we try to help them. But it's not uncommon that patients are worried because they think they have something serious, which many times they don't, but they need us to help them. And it's also not uncommon that they come in expecting a certain workup. So in your world in sports medicine, I'm sure there's lots of requests for MRIs, for example. Just a couple of weeks ago, actually last week, I had a patient on the phone. He said he didn't even twist his ankle. It's just his ankle hurts for 2 days and he wants an MRI over the phone. I said, can I at least examine you? And then we can decide together. But also they want a specific treatment. And I think we need to merge all that. We can't ignore what they have. But also if we do everything that the patient says, we could end up hurting them, but also we may not be a value-based, cost-effective. We need to do the right thing in an evidence-based medicine. So that makes it challenging, but also I think it makes it fun so that we can really give them our best.
No, I completely agree with everything you just said, and I've had experiences where a patient reached out to me and asked me, what do I think about having gallbladder surgery? And I said, what? And I didn't even realize. I guess the patient had been seen in urgent care, had gallstones, and was having colic, was referred to a surgeon. They offered him surgery, and the patient reached out to me and asked me what I thought or what I recommended because I had built that relationship with that
Yep.
patient. I had built that trust, and that is so important when it comes to helping patients feel supported, feeling validated, but then also kind of that balance or negotiating what a patient thinks they need or what Dr. Google tells them that they might need versus what they actually need and what is really evidence-based medicine. And I think that's the art of being a physician in this day and age is taking all the medical information, all the knowledge that we have, and then helping the patient understand how it applies to them as an individual, as opposed to anyone can find information out there, but learning about how to sort through what's good information, what's bad information, and how it applies to the individual patient. I think that is why I'm not worried about physicians being replaced by AI, because that
Yep.
sort of soft skill is critical when it comes to helping patients, but also making sure we're practicing, value-based care and high-quality evidence-based medicine.
I love it. And by the way, that says a lot. The patient wants to hear from you if they should get that gallbladder removed or not. And
Mhm.
that says a lot. So thank you for what you do, by the way, Dr. McDonald.
No, no. Well, thank you for supporting me and helping me do it. So let's shift now a little bit to kind of maybe that the systems approach. Obviously, I'm extremely proud of how Permanente Medicine really practices high quality, value-based care. And can you give us some examples about different innovative practices we've created across the organization regarding patient experience and how we can adapt again, like you mentioned this in this changing landscape?
Yeah, I love it. You know, one of the really very amazing things that we've been doing recently is that we've been meeting all the regions together, and we bring a topic, we speak about it, and then every region says what they're doing. And then in it, every region is doing great things, but also every region can pick up something from someone else. So I'll give you a couple of examples. Last year, we were meeting to talk about how to make the booking experience of our patients superb. How do we give them red carpet treatment to show them, because we are different in that we are integrated in Permanente. We're an integrated multi-specialty. And so when a patient comes to see us, we want them, and let's say we refer them to somebody. So let's say you see someone and they have ruptured Achilles and you need to send them to orthopedics, they need surgery. So when you put in that referral, how do we make sure that that patient walks out with the specialty appointment versus, phone tag and things like that? So that we've been doing, and we've been enhancing that, and we share that with the other markets. But then, as the other as the other regions were sharing, a couple of them said, "Why the way we do this, not just in the office, but we have the patients go and do self-booking online." And so we tried the pilot and to have the specialty, that specialty to have that patient, if we refer to them, actually it's general surgery and gallbladder is one of the symptoms, is one of the diagnoses. And the patient can book directly into that, because sometimes the patient is not ready to book when they're with us because they got to go check in with their significant other, check their schedule, check their work. And so we're trying that. It's been very promising, and we are planning to expand it and make it even much wider. So we have two ways to do red carpet treatment for a patient's experience with booking to show how integrated we are. The new thing that we're working on this year, that all the different regions are working on together to be able to enhance the experience, is how do we welcome our new members? We are a large, complex system. So how do we show them how to navigate, how to get in to hear things? So we've been just in the last couple of weeks, every region has been sharing what they're doing, and then we're trying to take the conversation to the next level. What is a minimum viable product that we want in anywhere where you are a KP member, that you get that same amazing welcoming experience? How do we onboard you when you come in with medications from outside? How do we make sure that there's no interruption to that? How do we make sure it's formulary so it's cost effective for you? So that's one of the things that we're working on together as all the regions together. If I may throw one more in there that I'm just very proud of, that is I think is going to be huge, a big deal. And it is it started going live late last year, but it's going fully live this year. And that is training our staff from a care experience lens. Right now, so there's onboarding of new patients, but there's also not onboarding of our workers, of our staff. And back in the day, onboarding of our staff, it used to be, here's your badge, here's this, here's that, here's the bathroom, here's how to get into Health Connect and all these in the electronic medical record and all these things. But then and it was like, and be nice. We said that's not, if we want to be known for care experience, we want to spend time, we want to invest. It costs money, but we want to invest in this. So everyone has a mandatory 4-hour training. And it's the same across the entire of Southern California, hospital-based, outpatient-based, 4 hours of care experience skills that we expect and that we will hold everybody accountable for. So that I'm very excited about, and I think it's gonna be a game changer, and it's gonna take us to the next level as we all speak that same language.
So I think that's such a great experience, and not to overuse the medicines too much, sports medicine euphemisms too much, but I always say that medicine is a team sport, right?
Yep.
From the check-in receptionist to the LVN or the MA who does the vitals, to my visit to the RN who follows up or does the vaccines, and having everyone sort of be on that same page and sharing the same message is just so critical to improving quality also. I cannot tell you how many times when I walk in the room and the receptionist reminded the patient that they're due for their pap smear, and the LVN reminded the patient that they're due for their pap smear, and prepped everything. And I can walk in and say, hey, you're due for your pap smear. You're all set. Let's get this important cancer screening test done. And the patient may not have been there for their pap smear. They've been there for something entirely different. But when we can all engage together as a team and help support that patient to get the high quality evidence care that they need, we can literally save lives and prevent disease. And that's something that I'm extremely proud of within KP. And I think that that experience and that quality that we all have within that whole system is just really, really valuable. So I love this new kind of staff onboarding process. I think that's really, really critical. So thank you for that work. I do want to jump back to something you said about just the patient onboarding
Sure.
process. And I have this all the time where I have new patients who are new to KP, and they expect that they need to come in to get their labs done, and they have to come in to get their medication refilled. And I'm like, look, I can do a lot of this virtually. I can do a lot of this through the secure patient messaging system. And patients just don't necessarily understand how accessing care can be much more streamlined within a big system, with a lot of kind of technology and tools within KP. So can you tell us about the patient onboarding process a little bit more detail, and how does that compare to other organizations, and what are we doing differently, and how are we doing, maybe a bit of a leading question, how are we doing it better?
Yeah, no, I agree. So I'll tell you, I've experienced it when I was in charge of a couple of buildings in the South Bay area. I've experienced this in a way, but now it's systemizing this. So what if I know that, yes, you and I can do this virtually and help the patient out without coming in. But what if we take that off your plate, Dr. McDonald? And we have all these things done. So the way it works, or it's supposed to work, and as we enhance it and expand it, is you have an MA, medical assistant, or someone, staff, call the patient, and they ask them what their medical conditions are, and they populate that in our problem list. They ask them, are they taking any medications? And then they also do their allergies, all the usual stuff, their history and all these things. And then, do they take medications? And then if they say yes, then they're transferred to pharmacy. And then pharmacy will go and then will make sure that those medications are ordered and are formulary. But also they take it a step further. Is some medicines require some labs. So let's say a diabetic comes in and they're on metformin. There will be an A1C, there will be a creatinine, there will be an ALT, and all the things that are pertinent for that condition. But then let's say someone comes in with um, rheumatoid arthritis, and is followed by rheumatology. They will also pen the rheumatology referral for us. And basically, we get one message, everything is in it, and all we press is sign. We just, as long as we agree, we sign and we're done. And so that's what we're hoping. We need you we need to take that off your plate and my plate. And that's why when the patient comes in, they're already known to us. And then we're ready to spend much more of the time rather than collecting information, but more of making that personal touch with the patient, and make the every moment count and make it very powerful. So that's, I think I can't think of any system that could do this better. And I've tasted it. It's amazing, but it needs to be everywhere.
Yeah, no, and I think it's a great example of how really the patient is at the center of all the work we do here within KP. And again, that's for me, that's the patient care experience, is really making sure everything we do is patient centered. And I know that with administrative complexity, administrative burden across the healthcare landscape, that having physicians do physician work, where connection with the patient, and having those difficult conversations, and having the other team members do work at the top of their kind of license to help support that patient journey, no matter how they enter the system. And I think that's such a great example, and I'm really proud of the work that we do at KP because of that.
I love it.
So let me can you kind of take what you've already touched on a lot of topics and kind of already addressed some of my questions, so I don't want necessarily to kind of go back or backtrack. But when it comes to engaging clinicians and physicians in particular, because I do think we have a really important role when it comes to the patient care experience. And I'm drawing a blank on who said it, but people forget what you do and what you say. They remember how they made you feel.
Yep.
And what advice would you have for our clinicians and our physicians to really think about how we can help patients feel supported and heard? Is there any resources or any tips or tricks you have for us?
Yeah, I mean, it's going to sound too simple and too obvious, but I think it's been transformational for me. When I had the light bulb turn on. Sometimes we can get a little when things are busy and when things are tough. Sometimes we can be a little off our game. But I think one thing that it just really resonated with me is treat patients like family and friends.
Mhm.
And not being fake though, being genuine, caring, authentic. That resonates with them. And it builds their trust, it builds loyalty. It actually leads to patient outcome, which you hit on that actually earlier. They become more compliant with medications because they trust us and they know that we actually care about them. We're not trying to push things at them. And I would say invest in each moment with our patients. They are our journey. They are our mission. I'll tell you something that one of the physicians in the building when I was leading it, this guy had the best scores in, patients were very pleased with him. And also he's the fastest one out of the building because
Mm.
you'd think it's the other way. You'd think you're going to be slow if you're very, very caring and all these things. But his patients love him more than anybody. And he's the first one out. So I decided I'm going to interview the guy. So I talked with him. I said, "Hey, what's your secret?" And then he told me something that I thought, "No, this guy's crazy. There's no way." He said, "Here's what I do. I go and I sit down. I don't stand. Okay, I do the same." Okay, I was like, "Yeah, whatever. That doesn't make you faster." And he said, "I say, how can I help you?" So open-ended, like we were taught in med school and in residency. Okay, I said, "Okay, I do that." And then he says, after they're done, I say, "Is there anything else?" And I said, "No, you're crazy. There's no way. If you ask that, you've just opened the door that you're going to be here forever. And I'm asking you because you get out of here fast, yet you resonate so much with the patients." He says, "That's what I do." And he says, "It's almost always, they never say there's anything more. And occasionally there's something, and I take care of it, and they're very happy and they heard." So I took that and I wrestled with it, to be honest, Dr. McDonald, a lot. I was like, I can't do this. This guy's crazy. There's no way. And then I decided to try it. And he is right. When we are really genuine and we care about the patients and we say, it's as if I have all the time in the world, even though I know our time is short and is crammed, it resonates, it actually goes faster. And when we don't cut them off and we say, so I that would be my tidbits. I know people might think I'm crazy, but try it because I thought it was crazy and I tried and it was amazing.
Well, it's funny actually you mentioned that because I do something very similar at the end of any patient encounter. I don't say, "Do you have any questions?" I say, "What questions do you have?"
I
And
love it.
it's a little bit of a nuance, but it makes a big difference, and it really centers the patient and helps them feel comfortable and to be able to bring those issues forwards. And again, it may not be we can't address everything in every visit, and sometimes I'll bring patients back and say, "Hey, look, that's let's focus on the things we need to do today in the exam room, and then we can talk about some of those other things maybe through a telephone visit or a video visit in a week or 2 weeks." And sometimes you have to sort of help the patient when there's a big list. But I definitely agree that keeping things centered and helping that patient feel validated and feel heard and feel like they're the most important person in the room at that moment, that is so critical. So that's a great way to wrap this up. We could probably go on and on for another 20 or 30 minutes about this, but we do like to keep these chats short and high yield. And so I'm going to ask you my last question. I ask all my guests here. What makes you most proud to be a Permanente physician?
Oh. So much. That one I can go on for 20 to 30 minutes, but I know that I didn't even feel the time, Dr. McDonald. It's been really fun speaking with you, and I love your energy and what you do. Your patients are lucky to have you. I love that we're value-based. And by that is we are agnostic to the insurance. I have some of my colleagues that are in private practice. I just, they tell me what they do, and I say, really, how can you, sleep well at night, by treating different patients differently? But I love that we are focused on the patient in front of us. We are looking at how to resolve the issues in using evidence-based medicine and in the least amount of touches. So being patient-centric, patients don't like to come to the doctor. They have other better things to do in their life. But also, I love that we don't have to worry. If we need to order an MRI, we order the MRI. If I need a specialist, I don't have to go through all this crazy approval process. They will see the specialist. I love that we focus on disease prevention. I also love that we do all the screenings, which is not disease prevention, but it's early detection. So this way we can have early treatment for the best outcome so that our patients have the best quality. I love that we are so ethical. That I would never change. I actually would, when I first came, I thought my plan was I'm going to be here for 3 years and then out and open my own practice. And after I stayed here, I said I would be crazy to go anywhere else. I want to be here, retire here. I want to receive care here. There's nowhere else I'd rather be. I love Permanente medicine.
Wonderful. Well, that's such a great summation, and really appreciate your time today. And thank you for sharing your insights, and thank you for all the work you do to support patients, but also support physicians, supporting patients and the whole care team.
Thank you so much, Dr. McDonald.